Some people think that a single-payer healthcare system would be more efficient. And others think that a market-based healthcare system would be more efficient. And as an economist, I find that discussion interesting. As a citizen, I find it irrelevant, because I personally believe that every individual should be free to make his or her own choices about healthcare and everything else. I am Bill Connerly, Chairman of the Board of Directors of Cascade Policy Institute. I welcome you here. This is a joint presentation of Cascade Policy Institute and the Washington Policy Center. We have help for putting this on from a number of sponsors: the Federalist Society's Portland Lawyers Chapter, the Benjamin Rush Institute, which provides economic education for doctors and medical students, the law firm of O'Donnell, Clark and Crew, Dr. Kathy and Jack Brown, James Huffman, the Shiloh Inns, and KBMP Radio. Please join me in thanking our sponsors. My first duty as Master of Ceremonies is a great pleasure to introduce our President, Cascade's President and Chief Executive Officer, John Charles. John made his first reputation in Oregon as the state's chief greenie. He was the head of the Oregon Environmental Council for 17 years, but over that time he evolved into believing that free market processes were better for the environment than central planning. We recruited John to Cascade Policy Institute, and I later convinced him to take over the leadership role to enable our founder, Steve Buckstein, to return to policy analysis. John has since earned his second reputation in Oregon as a tireless advocate for economic opportunity, personal responsibility, and individual freedom. John has become a nationally recognized expert on transportation and growth management, writing for audiences across the country and speaking in 24 states about Oregon experience in those areas. John received a bachelor's degree from the University of Pittsburgh, a master's from Portland State, and although he may seem like a policy wonk, he's a sports enthusiast and a keen volleyballer. John Charles.
Thanks, Bill. I only got here a few minutes ago because I was coming back from Salem, where I had to testify with 30 other people left over from a Tuesday hearing, at a hearing starting at 3 on the low carbon fuels standard bill that has been appropriately trashed by the Oregonian editorial board, not only this morning, but in previous editions. And although the low carbon fuels standard is not as complex and idiotic as Obamacare, it's not for lack of trying by the majority party for doing that. So I got my testimony in a hearing that was actually even more useless than most, and then got out of there and came up and got here, and I'm very happy to be here. As Bill said, I am a rather unlikely person to be running a think tank, which also raises the question of what is a think tank. So I'll just briefly say, if this is your first time here, Cascade is Oregon's free market research center. Our mission is to promote individual liberty, economic opportunity, and personal responsibility. We seek to change lives. It certainly has changed my life, because I never envisioned that I would be working here 18 years ago when I left the Oregon Environmental Council with no plan other than to get away from all these central planner types and wind up at Cascade. This is our 24th year. We have an office not too far from here in Raleigh Hills, and we work on a variety of issues, including the environmental issues I cover: healthcare, tax and budget, land use, school choice, a variety of issues that we think we can affect at the state level, sometimes the national level if we think we can make a difference, but mostly we're working at the state and local level. We have 9 members on our board. Bill is the chair, and staff of 6 and a various group of independent contractors who work for us as well. If you're not familiar with our business model, it is that we neither solicit nor would we accept any money from the government, and we raise all of our money each year from private voluntary contributions. And if at the end of the night you're so inclined as to consider one of those private voluntary contributions, there are people around on our board and staff who'd be happy to assist you in the transaction. So this is going to be a really fun event tonight, and I'm going to turn it over now to Steve Buckstein, who, as Bill said, hired me, and now Steve works for me, and he's going to transition more into a topic that I actually don't know a whole lot about, so I'm going to learn more tonight than most people here, which is about the black box of healthcare. Steve.
Thanks, John. I can't get into too much of the black box or we'd be here all night, and we want to hear from our main speaker, but I wanted to give you two pieces of news about healthcare policy in Oregon. One's good and one's bad from my perspective, and I hope from your perspective. The good news is that there is a right to try bill working its way through the Oregon legislature. Last year, 5 states approved what are called right to try laws that allow terminally ill patients. If you're diagnosed as terminally ill, you would have the right to try an experimental drug that had not yet been approved by the FDA. It passed unanimously in 3 states legislatures, and it received about a 78% vote at a referendum in Arizona last November. The similar bill in Oregon is House Bill 2300, and Representative Newt Buehler, he's supposed to be up here tonight, but he might have been tied up in Salem, is heading up a work group to try and hash out the details of the bill. I'm on that work group, so I've been intimately involved in what's going on. And just today, 13-year-old Diego Morris arrived in Portland. I got to meet him at the airport. He was the honorary chairman of the Arizona Right to Try bill. At age 11, he was diagnosed with terminal osteosarcoma, bone cancer, basically. And there was nothing that doctors knew that could cure him, but there was a drug that possibly could that was not approved in the United States. So he and his family had the wherewithal, the ability to move to London for a number of months to get treatment, and he's now cancer-free. And he's dedicating his life, and his mother, who came with him today, to basically give other people the right to try. You might on the evening news tonight watch Channel 6. They interviewed him when he got off the airplane. He's a young man wearing a suit and tie, really mature for his age. And when the reporter asked him, I'm not sure if this got on the story, but when the reporter asked him, what do you say to critics who, for various reasons, don't like allowing people to try something the government hasn't approved? And he looked at her and he said, wait till they're in my situation and then ask them. Pretty mature for a 13-year-old. So he went down to Salem today to meet with a number of legislators to basically tell his story about why Oregonians should have the right to try. The bad news in Oregon, there's a lot of it, but the one I'll focus on is one that actually was in Willamette Week yesterday, and we have a copy of the 6-page Willamette Week article, Kitzhaber's Secret Weapon, which is the self-described Princess of Darkness. I never called her that before, but apparently she calls herself that. And basically what Nigel Jaquist of Willamette Week reported on was that shutting down Cover Oregon was not a policy-driven decision, like a lot of people thought it maybe should be, but it was purely and totally politically driven. It was a crass political effort by former Governor Kitzhaber and his self-described Princess of Darkness, Patricia McCaig. Even if you're not an Oregonian, I know there are a number of Washingtonians here, you've probably heard that Cover Oregon took $305 million federal dollars, which are your dollars and my dollars, to build a website that never signed up one person under Obamacare, $305 million. And Nigel just broke the story yesterday that in private emails between Patricia McCaig and now former Governor Kitzhaber, he accepted her offer to quote-unquote manage the shutdown of Cover Oregon and shift the blame to Oracle Corporation, which was the prime contractor on the website, shift the blame to Oracle Corporation as a way to ensure the governor's reelection. Last April 9th, McCaig titled one memo to the governor, Managing/Staging the Decision, in which she said, quote, regardless, the Cover Oregon Board would hear and accept the federal exchange recommendation. The Cover Oregon Board is a semi-independent board that was appointed by Kitzhaber to basically manage this corporation that would spend wisely, hopefully, $305 million federal dollars to provide a healthcare exchange under Obamacare. So Nigel characterized this in his story as the illusion of deliberation. I love that line. The illusion of deliberation. And I got to see it firsthand, coincidentally. I actually testified before the board meeting on April 25th, a few days after that email went out that none of us knew about. I testified before the Cover Oregon Board on April 25th at their meeting, and I thought it was important to tell them, to put it on the record, that there was a risk that they, as far as I could tell, were not considering about shifting from Cover Oregon to the federal exchange, and that was that under what then was the Halbig case, now is the King case, if we did that, Oregonians may no longer be eligible for tax subsidies for insurance purchased through the federal exchange, as you'll hear more about later. Not one board member of those auspicious people even looked like they were interested, let alone asked me any questions at the board meeting. And they went on to basically vote to shut down the website and shift to healthcare.gov. But after the meeting, the interim CEO did respond to a reporter's question. I happened to stand over in the corner and listen. And the reporter asked him my question, basically, are you concerned about this, risking the tax subsidies of Oregonians? He said that the subsidy issue was something for the U.S. Supreme Court to figure out, and implied that he and the Cover Oregon Board needn't concern themselves with such things. So obviously such things didn't concern McCaig and Kitzhaber, and we now know that they were the only two votes that counted. But now there are 9 more votes that are going to count about this, and those are the U.S. Supreme Court members who, thanks in large part to our speaker tonight, will be hearing a case next Wednesday, March 4th, about making the Obama administration follow the letter of the law, which will affect in one way or another the state of Oregon and what we've done with Cover Oregon. So good news and bad news. Being an eternal optimist, I'd like to focus on the good news. So watch House Bill 2300, Right to Try, and hopefully support it if you can. Thank you.
Thank you, Steve. We'll now take a few minutes and shift our focus north of the Columbia River. And I'll begin by introducing Dan Meade Smith, who is the president of the Washington Policy Center, which focuses on sound public policy based on free market solutions. Dan is a major player in Washington policy discussions, having testified before dozens of legislative committees in Olympia and appearing on numerous TV and radio newscasts and programs. He's also appeared on the national PBS show Debates. He is a Rotarian, a board member of the Greater Seattle Chamber of Commerce, and has been asked by the governor to serve on numerous advisory boards, a graduate of Western Washington University. And he is visiting us with his daughter, who is looking at colleges in the Portland area, which means he must be a better father than me. Both of my kids wanted to go thousands of miles away from college. So please join me in welcoming Dan Meade Smith.
Thank you, Bill, and it's our pleasure to be here tonight. We appreciate the opportunity to co-sponsor this event with the Cascade Policy Institute, and we're thrilled that so many of you from Washington came across the bridge to be with us this evening. I'll just spend a couple of minutes talking about the Washington Policy Center, and then I'll introduce our healthcare expert, Dr. Roger Stark, to give a quick update on what's happening in Washington, just like Steve did what's happening in Oregon. So Washington Policy Center is a free market think tank, just like Cascade. We both belong to a national association called the State Policy Network. There's a Washington Policy Center or Cascade Policy Institute in every state now across the country, which is great. It's a new movement that's really taken off over the last 15 or so years to have these aggressive and very well-funded and very impactful state think tanks in every state around the country. And they've come from the bottom up rather than the top down. So we're very effective across the country, all these different organizations. Washington Policy Center is made up of 6 research centers. We have a full-time director who focuses on 6 policy areas. Healthcare, you'll hear from Dr. Stark. We have a small business center, education center, transportation, environment, and government reform. So a full-time director who focuses on each of those areas. We have 4 offices around Washington State. Our main office is in Seattle. We have an office at the state capitol, and then 2 in Eastern Washington. Over 30 of our ideas over the last 3 years have become law. So we measure our impact in how many of our ideas receive media coverage around the state and how many of our ideas turn from policy white papers to actual making an impact in either stopping bad policy or enacting good public policy. So it's great that our work is in the media 5 times every single day in Washington State media, and over 30 of our ideas have become law. Some of those are charter schools. We helped pass a charter school initiative in Washington State a couple years ago. We helped pass 2/3 tax limitation at the state level, and now we're taking it to the local level around Washington State. And we played a big role in making sure we don't have a state income tax in Washington. That was defeated by voters a couple years ago. We hold events around the state. We're hoping to hold more in Southwest Washington for our Southwest Washington supporters. We hold several in the Puget Sound area and definitely in Eastern Washington as well. Our annual dinner is one of the biggest events of its kind in the country. We bring in a national speaker and have over 2,000 people attend the event in Spokane and Seattle every fall. I mentioned our work in Southwest Washington. We've held our small business forums in Vancouver over the years. We're looking to hold those again, where business owners can talk to us about ways to improve the business climate in Washington State. We've done a lot of work on the Columbia River crossing through our transportation center. We just put out something today actually on that issue. Even though voters defeated, as you know, the light rail proposal across the bridge, they're still spending money in Clark County to work on light rail and to use eminent domain to condemn properties for future light rail. So there's a bill right now in the state legislature to prohibit that. While the voters have defeated that idea, the money is still being spent on light rail, which we don't think is a good idea. So we're working on that right now during the legislative session. And then we also promote the state's achievement index, where you can look up all of the schools in Clark County and throughout Washington State and see exactly where the school ranks. The state gives a letter grade to every school in Washington State, so it's a great way to open up that information of transparency to parents across Clark County to see where their school ranks, where there needs to be improvement, and to give parents some more information on their child's education. And then I mentioned the 2/3 issue. We'd love for Clark County and the city of Vancouver to pass a 2/3 tax limitation at the local level in Clark County. So we'll be looking at working with some of you to do that as well. There's a brochure in the back. On the left side of the table is information on Washington Policy Center for those of you from Washington State. We encourage you, like John said, to join the organization. You can fill out one of our cards and get added to our mailing list as a complimentary basis. So we encourage you to do that and learn more about our work. And I want to thank Ken Peterson. Ken is a longtime board member of the Washington Policy Center, longtime supporter. He's now a member of our board emeritus, and he gave John and I this idea of bringing Michael Cannon to Portland, and said, wouldn't it be great if the 2 organizations joined together and put on an event while he's here speaking at Willamette University. So I appreciate Ken's support and this great idea to get all of you together for tonight's event. Now I want to bring up Dr. Stark. So Dr. Roger Stark runs our healthcare center at the Washington Policy Center. Unique perspective because he's a retired heart surgeon who worked for years up in the Bellevue area as a practicing physician and then went into the policy world. We have a study called The Impact of the Affordable Health Care Act in Washington State, which we have copies of for you to take with you tonight. And Roger also is the author of The Patient-Centered Solution, a great, easy-to-read book that he put out a couple of years ago about solutions to reform healthcare across the country. And he's recently not only done work in our state capital, but he's getting more attention in Washington, D.C. And over the last 12 months, he's been invited to testify 3 times before Congress on the Affordable Care Act. So it's great to have him working on both the state side of healthcare and the federal side. Roger?
Well, thanks very much, Dan, and thanks to all of you. I'd like to take this opportunity to thank you for coming out tonight and supporting our think tanks in the state of Oregon and in the state of Washington. Let me start out by saying Will Rogers was one of my favorite comedians, and Will used to say, "I don't make political jokes. I just watch the government and report the facts." And that's pretty much what we do in a think tank kind of environment. Now, unlike Steve, who had good news and bad news for the state of Oregon, pretty much in the state of Washington, I've got bad news and bad news. After the Affordable Care Act, Obamacare, after it passed, our state jumped in with both feet, and they said, we are going to do this. Our state actually, in the early 90s, tried Hillary Care, if you remember that, during the Clinton administration. So basically, a number of our elected officials were primed when Obamacare passed to support this with both arms, both feet, everything else going for them. So what we did initially is in 2011, we set up a state exchange. We're one of about 13 states that's done this. Now you might say, okay, so you set up an exchange. How's it running? Well, it's running at about 60% of what was predicted. The back end of it is not running well at all. They're having glitches and problems and so forth with how much premium support people get, how they register, things like that. And the other huge thing is, no surprise with a government kind of program, it's running way over budget. They budgeted $40 million starting this year after the federal grants ran out. The board is now asking for $70 million per year to run the administrative side of it. We have elected officials in Washington who say, well, yes, but we're running Medicaid through our exchange and we're going to get all these federal dollars to help us support the federal exchange, which is essentially nonsensical. I will say, however, that 80% of the people who signed up on our exchange signed up on the expanded Medicaid side, which is a 100% entitlement. So that leads me to the second bad thing, which is the expansion of Medicaid. Our elected officials, they did this through a budget manipulation in the 2013-2015 budget cycle. And what they did is they just put Medicaid expansion as a line item. And the reasoning was we're going to get $350 million from the federal government to help us balance our state budget. We're going to do that by expanding Medicaid. We did the math on this, crunched the numbers, and we're actually several $100 million in the hole because we chose to expand Medicaid. And that's just this year, over the last couple of years. We have no idea what it's going to be in the future, but estimates are well up into the billions of dollars that it's going to cost the state of Washington because we chose to expand Medicaid. 20% on our state exchange are on the private side. There's not enough premium tax there to fund the exchange, and Medicaid is going to be just a huge deficit hole for the entire state. So that's the bad news and the bad news in the state of Washington. We don't know where it's going to go from here, but the future is not particularly bright. As I say, we're one of 13 states to set up an exchange, one of 26 states to expand Medicaid. So we're right there on the forefront of what's happening nationally with health care. With that, I think I'll end, and looking forward to Michael Cannon's remarks.
Thank you, Roger. I think the two organizations should collaborate again, but next time, instead of competing on which state is wasting more money, we should compete on which state is more effectively serving the people. But perhaps I've had too much to drink. So let us shift to the main program here. Michael Cannon is the Cato Institute's Director of Health Policy Studies. And if you're not familiar with Cato, it's like the Washington Policy Council or Cascade Policy Institute for national issues. They look at us in envy. Mike has been described by the Washington Post as an influential healthcare wonk. The New Republic said he was Obamacare's single most relentless antagonist, and Vox.com described him as the man who could bring down Obamacare. He's been interviewed on all the major television stations. He's written articles for newspapers and academic journals. He is the co-editor of Replacing Obamacare, the Cato Institute on Healthcare Reform, and co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It. And a major industry lobbyist is an old colleague of his, and he suggested to her that she pay him a big fee to go to her state and talk about health care. And she said, representing the industry, I would pay you a big fee to stay out of our state. Here is Michael Cannon.
Thank you so much, Bill, and thank you, John, and Steve, and Dan, and Roger, and Beth, and everyone else who made this possible, and all of you for coming. I am happy to be here. I'm happy to be talking about healthcare with you. I'm going to see if I can lift your spirits a little bit. Usually what we tend to do at these policy events is we talk about a lot of doom and gloom, and there's certainly a lot of that in healthcare. I want to give you a little bit of reason for optimism, though. One reason for optimism is that there is a world, an entire world of conveniences and innovations that make healthcare better and more affordable and more secure, that reduce the cost of healthcare and reduce dependence on government, that let you avoid ridiculous waits in the doctor's office, sometimes by letting you speak to your doctor or check your lab results online. But most important, there are innovations that provide for secure health insurance with a total satisfaction guarantee. Have any of you ever heard of health insurance with a total satisfaction guarantee? No, because it hasn't been developed yet, right? Have any of you heard of health insurance that lets you buy an option on a health insurance policy? Did any of you know that before Obamacare, you could buy an option on a health insurance policy, pay a fraction, maybe 10, 20% of the premium for a health insurance policy, just have the right to buy it at any time, no matter how sick you get? No matter if you've got a pre-existing condition? I see like one hand going up in the back. You must be a broker.
I listen to Cato podcasts.
Even better. All right, give that man another drink. So, and this existed. You might call it pre-existing condition insurance. It does exactly what Obamacare was trying to do, protecting people against being turned down for health insurance because they have a pre-existing condition. And it was really affordable, like $40 a month or something. It existed. These innovations are out there. So are innovations that will encourage health insurance companies or create a health insurance market where insurance companies compete to cover the sick, not to avoid the sick as they do under Obamacare. And health insurance, it doesn't disappear just because some politician made a false promise. Now, at the Cato Institute, we've had some success, mostly working with state think tanks like the Washington Policy Center, the Cascade Policy Institute, at getting reforms enacted at the state level that actually make health care more affordable, or bring it within the reach of poor people, that expand access to health care for the poor. We haven't actually done it in Washington and Oregon yet. I'm really looking forward to that, and I hope someone during Q&A will ask me about what those reforms are, because I think that you should really look at those in your states. But unfortunately, most of the innovations that are out there lie on the other side of Obamacare. They're not going to happen as long as Obamacare is on the books. So if we want to make healthcare better and more affordable and more secure, we have to get rid of Obamacare first. If we want to care for the most vulnerable in our society, we simply have to take that step. So today, like I said, I'm going to try to give you a reason for hope, a reason to hope why that's why all that this law and the people who are implementing this law or not implementing this law have done to our healthcare sector can be changed. So we learned the hard way. Let me see if I've got this right. All right, now it's on. There we go. We learned the hard way that there's a wide gulf between what the people who gave us this law say about it and how it's going to work and how this law actually works. You all remember this one? We heard that if Congress passes the Affordable Care Act, it'll let everyone keep their health plan, keep their doctor, and cause premiums to fall by $2,500. That all turned out to be false. On March 4th, though, Wednesday of next week, I keep giving this talk and I keep saying March 4th, and now it's less than 7 days away. I got to say Wednesday. On Wednesday, the Supreme Court is going to hear a case called King v. Burwell that exposes what I think is the most painful false promise associated with this law yet. This case is not a constitutional challenge to the Affordable Care Act. It's not a challenge to the Affordable Care Act at all. It's a challenge to the IRS's attempt to expand the Affordable Care Act by fiat. To expand Obamacare's individual mandate and its employer mandate by subjecting more than 57 million taxpayers to those mandates, taxpayers whom Congress exempted, people who are exempt from those mandates by law, and yet the IRS is imposing those taxes on them. In two cases that are essentially identical to King v. Burwell, there are three other cases that are making their way through federal courts. In two of those cases, lower courts have already found that the IRS unilaterally and unlawfully expanded the ACA by imposing those mandates, those taxes on 57 million taxpayers across the country. In Halbig v. Burwell, the DC Circuit said that what the IRS is doing here, they can't do. The text of the ACA itself unambiguously forecloses the IRS's interpretation of the statute. The Eastern District of Oklahoma said that what the IRS is trying to do is invalid and said they got to knock it off, they got to shut it down. Now in King v. Burwell, the fourth case, we don't have an opinion in it yet. It's being held in abeyance pending the resolution in King. But in King v. Burwell, we have the one circuit court opinion, appellate court opinion, that went for the government, where the IRS won. And even that court said, well, you know, a literal reading of the statute accords with the plaintiff's position, not the government's position. But they said the statute's ambiguous and the government wins on ambiguity. So what is this expansion, and how is it affecting those taxpayers I mentioned? As I said, there are about 57 million victims of the IRS's unilateral expansion of this law. And they're people like Kevin Pace. Kevin Pace is a jazz musician. He's an award-winning jazz musician and a professor of music in Northern Virginia, near where I live. I've actually heard that we have some friends in common. I've never met him. The Washington Post wrote about him, though, because when the IRS expanded Obamacare's employer mandate by fiat, his employer, the college where he teaches, was forced to cut hours for part-time workers like him in order to avoid massive penalties. So he didn't actually have to pay any taxes to the IRS. His employer didn't have to pay any taxes to the IRS as a result of what the IRS did. His income just fell by about $8,000. Now, I don't know about the people in this room, but to me, $8,000 is a lot of money. I bet to a jazz musician, it's even more. He was left, the Washington Post reported, with an $8,000 pay cut, and the same thing was happening to thousands of other workers in Virginia who also had their hours cut, and thousands, if not millions, of workers across the country. And some other examples. In Utah, the Granite School District cut hours for about 1,200 part-timers, cut into their incomes as well. According to the state of Indiana, which filed a similar challenge, the one that did not make it up on the big board, the Indiana said that this IRS power grab forced, quote, many Indiana public school corporations to reduce the working hours of instructional aides, substitute teachers, non-certified employees, cafeteria staff, bus drivers, coaches, and leaders of extracurricular activities. These are the people who are being hurt by the IRS's power grab, but that's not it. That's not the entire universe of those who are suffering. Kevin Pace's employer suffers because it has less flexibility to structure its health benefits and less ability to offer attractive educational options to its students. Their customers, the students, also suffer because they have fewer educational choices. And some of the victims of the IRS's power grab lost their jobs, others lost their freedom to choose more flexible health benefits, and others lost income because their employers had to pay penalties to the IRS, so they couldn't so they couldn't raise salaries or wages. As Kevin Pace told the Washington Post, quote, "This isn't right on any level." He's right. He would be right even if this mandate were legal, even if the IRS had the statutory authority to impose this mandate on him and his employer, but it doesn't. And as if that weren't bad enough, the IRS also expanded Obamacare's infamous individual mandate, imposing that on an estimated 8 million Americans who are by law exempt. So when it comes to those folks, the IRS is illegally forcing millions of Americans to buy coverage they don't want. At the same time, it's illegally forcing millions more to pay penalties for not buying coverage they don't want. As I said, these mandates are bad enough when they're legal. They're even worse when they're illegal. And in the 38 states with federal exchanges, and I should mention, that's not the only effect of, or the way that this law works. The reason that these mandates are being imposed on these taxpayers is because the way Obamacare works is those taxes are triggered by subsidies. Subsidies offered through health insurance exchanges. You've heard a lot about Cover Oregon, about healthcare.gov and the debacle there. Those are they used to be two different kinds of exchanges. The ACA says to states, we want you to establish a health insurance exchange, but if you don't, the federal government will. And through those exchanges, the law authorizes tax credits. They're really just subsidies, checks the IRS writes to insurance companies on behalf of healthcare or exchange enrollees, really to hide from them the cost of this very expensive coverage that Obamacare is forcing them to purchase. Those subsidies are what triggers the penalties against employers, and in a more attenuated but equally clear way against individuals under both the employer and the individual mandates. It is the fact that the president is issuing those subsidies in states where he has no authority to do so, and let me come back to this slide, that triggers penalties against those 57 million employers and individuals. Here's what the statute says to states. Each state shall establish an exchange at Section 1311. In Section 1321, it says, hey, if the state fails to do so, Secretary of Health and Human Services, we want you to do it. The Secretary shall establish and operate such exchange within the state. And then later on, the law says we're going to offer those subsidies, but we're only going to offer them where? We're going to offer them through an exchange established by the state. It's actually pretty clear. Through the exchanges established by the state under Section 1311, the section dealing with states establishing exchanges. It's actually pretty clear. It repeats that restriction a couple times in the eligibility rules for those subsidies, and it's repeated 7 more times by cross-reference. And it's those subsidies that the IRS is issuing in 38 states, by my count now, without congressional authorization. I like to put this map up because these are the states that did not establish an exchange themselves. They defaulted to a federal fallback exchange. I like to use this map from Vox because it's got the wrong number up there. It's 36, it should actually be 38. But they also didn't highlight 36 states. They got that wrong too. There's only 35 highlighted here. Then they put out another map that was wrong for other reasons. And so I just like having both Vox maps up there and having fun with my friends at Vox. If you remember the first slide, they're the ones who said I'm the guy who could bring down Obamacare. Keep these maps in mind when you read Vox headlines like that. These are the states these are some of the states that didn't establish exchanges, and yet the IRS said, well, we're going to go ahead and issue those subsidies in those states anyway, even though they don't have an exchange established by the state. And it's in those states that those subsidies are illegal and therefore triggering illegal penalties against employers and individuals. Now, if King v. Burwell prevails, King v. Burwell is not a challenge to the Affordable Care Act. It's a challenge to the IRS's attempt to expand that law by fiat without going through the legislative process, by issuing those subsidies and imposing those mandates in states where it doesn't have the authority to do so. And this is a graph that shows what the impact of ruling for the plaintiffs in King v. Burwell would be. The blue bars show how many people in each of these 30, I think I actually have only 36 states here too. Each of these 36 federal exchange states would be freed from those illegal mandates. In Texas, it's something, what is that, 8, 9 million? In some states, it's millions of people, 57 million overall. The red bars, if you're in the back, you probably can't even see that there are red bars here at the bottom. Those are that's the number of people in each state that would lose subsidies, illegal subsidies, to which they were never entitled if King v. Burwell prevails. The good from this ruling would vastly outweigh the harm. Now, we were looking at the statute. Some people have asked, why would Congress do this? Why would they only offer tax credits in states that establish their own exchanges and not offer these subsidies in states that didn't? And some people, and this is a claim that my co-author who writes on these issues with me, he's a law professor named Jonathan Adler. I call him my partner in crime fighting. We've explained it's very simple. You know, Congress wanted to create an incentive for states to implement this program, to establish and operate an exchange so the federal government wouldn't have to. Some people said that's crazy. They would never do that. And we said, yeah, right, that's crazy. It's so crazy that no one has ever proposed anything like that except for, President Johnson, President Nixon, President Clinton again, the guy who wrote Obamacare. He did it on 2 previous occasions, actually enacted it and proposed it. This is Senator Max Baucus, chairman of the Finance Committee. Tom Harkin, the chairman of the other Senate committee that works on health. During the debate over Obamacare, produced a bill that did exactly the same thing, withheld these exchange subsidies if states didn't implement that health bill. The Supreme Court said, oh yeah, by the way, this is what the Affordable Care Act does with regard to the Medicaid expansion. In fact, that's how the whole Medicaid program works. If states implement a program that meets federal specifications, they get tons of federal cash, and if they don't, they get absolutely nothing. And in fact, the Medicaid expansion in the ACA told states, either you expand your Medicaid programs to everyone earning 138% of the federal poverty level and below, or you're going to lose all federal Medicaid funds, so we're going to take away subsidies from the poorest of the poor in your state. Pretty draconian, if you ask me. Pretty unthinkable. Oh, there was also members of Congress complained that this is what the ACA did. They didn't want it because if a state did not establish an exchange. Oh, that quote's getting cut off. But what he says is it relies on states with indifferent leadership, and if they don't establish exchanges, their residents will be no better off than before Congress acted. And this NPR reporter dutifully reported on that very accurate observation about the bill, said that if they don't create an exchange, their uninsured residents will have no way to benefit from the ACA. And then there's our friend Jonathan Gruber. I'm sure you've all heard of Jonathan Gruber by now. He's an architect of the ACA. He said 2 years after it was enacted, if you don't set up an exchange, your citizens won't get their tax credits. And then never mind that guy. So that stuff is all legislative history, which doesn't even matter to the courts, or shouldn't matter to the courts. The federal courts had found the IRS broke the law here, didn't even rely on any of that stuff. They just looked at the plain language of the statute and said that the statute itself, quoting one of those courts, unambiguously forecloses the IRS's interpretation. The other one, as you recall, called that an invalid interpretation of the statute. So when I told Vox, and I got this part right, when I told Vox that I'm 100% convinced that the people who wrote this law meant to withhold subsidies in uncooperative states, I based that entirely on the text of the statute. So this raises a question. If that's what the law says, and that's what Congress intended, then why didn't the president the IRS just follow the law as written? Why depart from the text in this way? Well, the evidence that we have is really incomplete. The administration, the people who wrote this law, they haven't released records about what their internal communications when they were putting this part of the statute together. Nor has the IRS really made public any of its communications about how it decided to depart from the plain meaning of the statute. But the evidence that we have suggests that the IRS and the administration, the rest of the administration, saw the 2010 election results. You recall President Obama referred to them as a shellacking. A lot of Republicans were elected, not just at the federal level, but at the state level as well. And this law relies on states to implement it. The evidence suggests that they saw those election results. They realized that the Republicans who were just elected at the state level could use this provision, the fact that the statute conditions its major taxing and spending provisions on state cooperation, that they could use this to veto major parts of the ACA. And that would create such big problems that even Democrats in Congress would vote to reopen the statute. So it appears that the IRS, in consultation with political appointees in the administration, decided to implement these taxes and these subsidies in states that did not establish exchanges, and thereby to take away the state's power to block these provisions. In effect, they decided that they would rewrite the statute and disenfranchise the voters who had put in place all those state officials to block the ACA. Now, what's heartening about this story is it means that those of us who oppose this law and thought all this time that we weren't able to block it were wrong. We didn't lose. We won. We beat this thing because, oh wow, that's a long time ago to get back to Vox, because we blocked it in all of these states. And we also blocked the Medicaid expansion in many states. Congressional investigators have found that, and the reason I say this, the reason I think that this was a conscious decision, is that congressional investigators have found that the IRS, in writing its regulations implementing this part of the law, initially included the requirement that residents purchase coverage, quote, through an exchange established by the state in order to get one of these subsidies. But around the same time that political appointees at the Treasury Department learned that ACA opponents were eyeing this provision as the basis for a challenge to the law, around March of 2011, not too long after those 2010 elections, is when this statutory requirement mysteriously vanished from the implementing regulations. Congressional investigators who were out to go into a small room at the IRS building and look at these documents without any cameras, only a notepad, were able to compare the different drafts, and they saw that that's when this statutory requirement disappeared. And then in August 2011, the administration announced subsidies would be available through both state-established and federal exchanges. And despite instant and sustained criticism that the IRS had no authority to do so, it took a legal challenge and more than a year before the Treasury Department or IRS even attempted to offer any statutory basis for this decision, for its action. Now, from that day in October 2012, when they first tried to articulate some statutory justification for what they did, the administration's attempts to justify its actions have resembled a fishing expedition. They've been fishing through the statute to find something that will give them the authority to depart from the plain text of the law the way they did. And I call it a fishing expedition because every time they say, oh, hey, look, we've got a nibble right here. Look at section 1321C, or oh, wait a second, look at the qualified individuals definition in section 1312. You reel in that nibble that they've got, and you find that's not a fish, that's a boot, that's an old car tire. You're pulling in tin cans here. And a couple of examples of how they're just fishing for justification for their predetermined outcome. They say, well, you can't just look at that isolated the phrase in the subsidy eligibility rules in isolation. You have to look at the entire context of the law. Well, no one disputes you have to look at the entire context of the law, but there's no context that conflicts with the plain meaning of that eligibility requirement. In fact, that eligibility requirement runs throughout the eligibility rules for these subsidies, and there's nothing elsewhere in the entire 2,000-page statute that conflicts with that requirement or casts doubt on what Congress meant. Here's another example of a fishing expedition. All right, that is not cut off. That's where it begins. They'll look at the statute and they'll say, okay, well, the requirement is that the people enroll in an exchange established by the state if they want to get one of these subsidies. But then when the statute says that the secretary shall establish and operate such exchange within the state, What that means is the Secretary is establishing the same exchange that the state would have established. So there you go. Voila, an exchange established by the Secretary is an exchange established by the state. This is a very close cousin of the administration's argument that it made before the Supreme Court just a few weeks ago, where they said, and this is a direct quote, I'm going to steal from Dave Barry here, I swear I am not making this up. The administration told the Supreme Court that the phrase established by the state under Section 1311 is a term of art that includes an exchange established for the state by HHS. They called an exchange established by the state a technical term that reflects style and grammar and not a substantive limitation on what the IRS can do. Now, this is not quite as absurd as it may seem at first, okay? In the government's defense here, Congress could have defined that phrase to mean anything it wanted. It could have defined that phrase to mean a bologna sandwich if it wanted. Congress has that power. In fact, Congress defined state to encompass the District of Columbia. It's right there in the statute. It says that in its title, the term state shall refer to each of the 50 states in the District of Columbia. DC is not a state, but Congress can define it as a state if Congress wants to. They did the same thing with territories. They said territories that establish such an exchange shall be treated as a state. Congress can do this. Congress can give terms any meaning it wants, but the IRS cannot. The IRS cannot say what this text means is bologna sandwich. Because if the IRS can depart from the ordinary meaning of terms without Congress authorizing them to do so, then that transfers the executive power, the legislative power from Congress to the executive, and Congress did not do that. There's absolutely nothing in the statute that defines a federal exchange as having been established by the state. So what's really going on here? Well, what basically has happened is, if you recall the history of Obamacare, the House passed a bill, the Senate passed a bill in the wee hours of the morning on Christmas Eve in a dark closet with a flashlight. And they were going to go to conference, and they were going to produce one bill, and it was going to pass through both houses, but then something funny happened on the way to Utopia. The good people of Massachusetts took the distasteful step of electing a Republican to fill the seat once occupied by Ted Kennedy, largely to stop this law. And when that happened, Democrats could no longer overcome a Republican filibuster in the Senate. So the only way they were going to get a health care bill through Congress and onto the president's desk was if the House passed the bill that had already passed the Senate. So what's interesting about that is no one expected the Senate bill to be the final bill. They weren't writing a final bill. In fact, I bet if I had a dime for every time someone said, don't worry about it, we'll fix it in conference about the ACA, I'd be a very wealthy man. I'd give a lot of that money to Kevin Pace right now. They put this bill together so it would get to 60 votes in the Senate, and they weren't thinking about implementation. But then all of a sudden, as one White House official said, this is the last helicopter out of Saigon, okay? This is our only chance to get a bill passed. It is either this bill or nothing. So we really shouldn't be that surprised if parts of it seem weird or don't work, even though, but that isn't the case here. This part of the law is actually very tightly worded. But what's happening here is that the people who bought this law are now having buyer's remorse. They complain, if King v. Burwell prevails and all these people lose subsidies in 36, 38 states, then Obamacare won't work. And the answer to that is, yeah. Because that is Obamacare. And you're right, Obamacare doesn't work. Now, it's not that Obamacare doesn't work as badly as Obamacare is not as bad as what we will see after a ruling for the plaintiffs in King. Because if the president had followed the law, then we would have foreseen all of that dislocation, and Congress would have dealt with it in 2013 before anyone became dependent on these subsidies. So the blame for the additional dislocation lies entirely with the president. But the good that will come from a King ruling vastly outweighs the damage done, the damage that he has done. And that good includes, it would allow more, after a King ruling, healthcare.gov enrollees would be able to purchase more affordable coverage. Yes, they would lose those subsidies. Yes, they'd have to pay, the amount they would have to pay out of pocket for their coverage would be higher, but they would be able to switch to a more affordable plan, or at least they will be able to if the administration lets them. The administration has adamantly refused to talk about what it will do to help 5, 6, 9 million healthcare.gov enrollees after an adverse or a ruling against the government in King v. Burwell. Another one of the benefits of that ruling is that it will make the cost of Obamacare transparent. The subsidies at issue here don't reduce the cost of anyone's insurance. They just shift it from the premium payer to the taxpayer. That hides the cost. Getting rid of those subsidies makes the cost transparent, and that will be painful. But as opponents of the law have warned all along, Obamacare is painful. That will just reveal the pain. And that will create an opportunity for health reforms that offer secure health insurance that doesn't disappear because some politician lied or broke the law or made some false promise or because of political disputes. A ruling for the plaintiffs also would free those 57 million taxpayers from illegal taxes. It would increase jobs, hours, and income, particularly for part-time workers and minimum wage workers. It would allow them to choose more flexible health benefits. It would allow states to have an economic development tool. They'd be able to compete for jobs by saying, hey, look, you come here, you relocate here, you're not going to have to face the employer mandate that you're facing in, Washington or other states that had established their own exchanges. It would restore the separation of powers by stopping the IRS from usurping powers that belong exclusively to Congress. It would restore a power to the states that Congress granted them, the IRS has tried to take away. And it would stop what I think is by far the worst example of IRS abuse that we have seen in my lifetime, and I was born during the first Nixon administration. So that's, and have lived through the first Obama administration as well, so that's saying a lot. So I'm going to stop there, and I hope we still have time for questions, and I want to thank you all again.
Thank you, Michael. We will take some questions, and I would just like to remind you, a question is a question. It is not a long harangue. But, all right. Yeah.
Could you go into more detail on the information you gave to the Oregonian a couple of months ago, explaining that even though we will be using the federal exchange, we will still qualify for the subsidies, regardless of how it's being decided?
I'm not sure so Oregon's status is really interesting. Oh, repeat the question, sure. I was asked to elaborate on the answer that I gave to Nick Budnick of the Oregonian that the subsidies would still be available in Oregon.
The headline said that.
The headline said that. I didn't quite say that. I think that I had that discussion with him before the decision was made to switch to healthcare.gov. And now, if that was my answer, I don't think it was, but if it was, my answer would change now. So Oregon's situation is really interesting. Because in order to qualify for subsidies, it has to be, your state has to have an exchange that is, quote, established by the state. That your residents have to purchase health insurance through an exchange established by the state. And the only way to have an exchange established by the state is really to avoid having a federal exchange. If the federal government establishes an exchange in your state, legally, if it's legally a federal exchange, that means no subsidies. So, and to avoid that, you can't just pass enacting legislation, as Oregon has done. And hasn't done much else, but you have to do more than that. You have to have a functional exchange that meets all sorts of criteria laid out in the statute. Actually, what the statute says is the state has to, there are two bright lines. The state has to elect to establish an exchange and then pass a law or regulation imposing all the standards, all the exchange standards and other related standards in that state. And then the secretary has to determine that they're doing a good enough job. They're doing an acceptable job. So if the state does those two things, then the secretary has all sorts of discretion. The federal Secretary of Health and Human Services has all sorts of discretion to say, no, you're doing fine, you're a state established exchange, so the subsidies keep flowing. However, there are some bright lines in the statute that would appear to take away the secretary's discretion to say that you are meeting all those standards, even when you're maybe not. And one of those requirements is that an exchange established by the state is only authorized to contract with certain, quote, eligible entities. The law says that these eligible entities have to be subject to the laws of the state. They have to be nonprofits, and I think there might be some other requirement. But the federal government, you'll notice, does not fit into that definition of eligible entities because it's not subject to the laws of the state of Oregon. So the fact that Oregon is now contracting with a non-eligible entity to run its health insurance exchange, i.e. the federal government's healthcare.gov website, means that it appears that Oregon does not have a state-established exchange anymore. Legally speaking, it has a federal exchange. And that so that means if the plaintiffs win in King v. Burwell, then by law, it appears that the subsidies should stop in Oregon as well. Now, if there's anything we've learned from observing the Obama administration's behavior in health with regard to the Affordable Care Act and other areas of federal law, what the law says is not always what the administration does. So the administration may say, well, Oregon is good enough for government work and we're going to keep the subsidies flowing there. But that creates the opportunity for someone in Oregon who thinks they are being subject to the employer mandate or the individual mandate unlawfully to say, wait a second, no. Oregon did not do all of the things that it's supposed to do before the federal government can tax me. And that employer or that individual, maybe someone in this room, I don't know, could file a legal challenge, much like King v. Burwell, and try to stop the administration and the IRS from skirting the law yet again.
So, Patrick, have you found somebody? And what we're going to do for questions is catch Patrick's eye, and he will bring a microphone to you. If you're one of the
wave
lucky
money in the air, that's always the best way to do it.
Go ahead.
Is this working?
It is.
It seems to me, in observing the fallout, that probably many of the people, maybe the majority of the people who have been impacted negatively by Obamacare probably voted for Obama, like your bass player here in the Arts and Humanities Department, University of Virginia. Are you kidding me? Do you think those teachers voted Republican? So can you speculate as to the people who are impacted negatively, they probably voted for it? And isn't this sort of the ironic justice for their vote?
Well, there is a certain that is something that a lot of us enjoyed some Schadenfreude when we noticed that a lot of these stories about people who were having their hours cut were stories about adjunct professors who are probably unreconstructed Marxists, and serves them right. At the same time, and you know, if you don't want, I'm not going to pull a Gruber here. You don't want ignorance to be costless. You don't want the wrong answer to be cost-free. You want people to bear the cost of their own bad decisions, and so if they're supporting bad policies, you want them to bear the cost. At the same time, I'd still rather they not be facing these taxes, especially these illegal taxes. But an interesting, there are all sorts of victims of Obamacare. There's some beneficiaries, but there are also all sorts of victims. And interestingly, some people have looked at those who would lose subsidies if King v. Burwell prevails, and look at those states. I mean, they're generally Republican states, because those are the states that didn't want to implement this law. Now, Maine is not exactly a Republican state, but they got a really interesting governor up there who didn't want anything to do with this law. So that the politics of this are pretty interesting. The demographics of the people and how they're affected. Right.
All right, who's next?
In Washington State, the original year after the implementation, we had numbers running as high as 90% of people using our exchange were in fact signing up for Medicaid. And then most recently, and tonight it was mentioned that we're down to 80%. Oh joy. I don't know of any citizen that truly, if they had their own money, would go sign up for Medicaid. Do you have a sense nationally of the percentages of our citizens in America that aren't getting private health care, but in fact are getting Medicaid? And then any comment on, is that their ultimate goal? The single payer becomes the government via Medicaid because the overwhelming majority of Obamacare recipients are in fact getting Medicaid.
I think that's a common retort that you'll hear in Washington D.C. whenever the left says, "Well, we want Medicare for all." We say, "No, you want Medicaid for all." you're promising us Medicare for all, you're going to get Medicaid for all. I'm surprised that when Roger and Steve were talking about this, saying all sorts of bad things about Medicaid and how it's going to blow a hole in the budget, and I said, can we say something nice about Medicaid here? I mean, on the bright side, the coverage is lousy. Which is really about the only thing that Medicaid has going for it. If the coverage were as good as Medicare, you would have all sorts of people ditching their private insurance and enrolling in Medicaid and becoming dependent on the taxpayers. So I think that's actually as painful as it is to say, a virtue of Medicaid. But that is the danger. I mean, it is amazing and really testament to how the political system doesn't respond to different groups equally, that most of the discussion about Obamacare and how it was a government takeover of healthcare and people denying that took place entirely within the realm of the exchanges and what they would do to private insurance. When over here Medicaid was being expanded to make as many people dependent on government as are over here, and no one paid any. We're calling it a government takeover, and people were saying, no, it's private insurance in the exchanges. Well, what about Medicaid over here? And it was completely ignored because Medicaid doesn't affect most. I mean, it doesn't affect the political class or middle and upper middle income people, and so it just doesn't get as much attention.
Massive
Yes.
government. Healthcare is not working. And I want to ask you, if you could pick, what kind of a system would you recommend?
In Libertopia? In Libertopia, so the kind of healthcare sector I'd like to see is one where the government plays no special role at all in the healthcare sector. Not no role. I want to be able to sue Dr. Stark if he leaves some of his tools inside of me when he sews me up. I want protection from, not Dr. Stark, but from negligent doctors and pharmaceutical companies who, if they make a pill, it starts killing people. We need the government to protect us in those cases, to make us whole when people have harmed us. We need the government to enforce contracts. But from what I can tell from having studied this for a couple decades now, every time the government tries to go beyond that to either improve the quality of care or reduce the cost of care, it has exactly the opposite of its intended effect. And so I would like to transition away from a system where the government distorts our health insurance decisions by giving us a tax break for this kind of health insurance but not that one, away from a system where the government decides who can be a doctor and who can be a nurse and what kinds of tasks they can perform and how they can organize their practices and so forth, away from the system where the government provides medical care to the poor and to the elderly, transferring all sorts, redistributing income all over the place along the way. I'd like to get rid of all of these government interventions. Not because I think in Libertopia there will be zero unmet medical need. There will be people who fall through the cracks in Libertopia. I know it because health care is a human endeavor and humans are imperfect. And so we're never going to keep everyone from falling through the cracks. I think what Libertopia has is over any other system that you can design is that free markets use innovation to fill in those cracks so that fewer people fall through. And what I like to say to my friends on the left is if you don't think that people are falling through the cracks in your system, you don't understand your system very well and you don't know what all the cracks are.
Yeah, I'd like to turn to the Supreme Court argument. And that is, I know you have Jonathan Gruber on tape basically saying that the subsidies only go to those that have state exchanges. But what kind of evidence do you have from the arguments that were occurring in the congressional meetings prior to the establishment of that the other people that designed this actually intended only for the states to have?
You may be disappointed to know that I showed you all of it. Absolutely all of it. I mean, I only mentioned the most important evidence of what Congress intended is what they enacted into law. So we're really not as concerned with what Congress meant to do or wanted to do as we are with what Congress did, because it's the statute that passes, the bill that passes both chambers of Congress and gets signed by the president that becomes the law. The Constitution doesn't say anything about congressional intent. And if that statute is clear, then that's the law and that settles it. And if you want to talk in terms of congressional intent, there is no better evidence of what they intended than what they enacted into law, especially in an instance like this, where their choice was this bill, no matter what it says, or you get nothing. And if they say this bill, then yeah, that's what you intended. But one of the really interesting things about this debate is that there's almost no discussion of what happens if states don't establish exchanges, and even less about what happens to those subsidies if states don't establish exchanges. I really did put all of it up there for you. It was one letter from those from 11 Texas Democrats to Nancy Pelosi and Barack Obama saying, don't go with the Senate approach to exchanges, because residents of recalcitrant states won't see any benefit. They didn't even mention subsidies explicitly. And I've had really ridiculous conversations with people, including that reporter I quoted, who thinks that I'm totally taking her clear words out of context. That, well, no, they weren't talking about those subsidies. And I said, is a subsidy a benefit? And they say, well, yeah. So, okay, well, it's categorical then. Anyway, there's almost no discussion of this in the congressional record. And I've looked at every mention of exchanges in the entire congressional debate over this law. And that seems odd until you consider a couple things. One, they never expected this to become the final law, so why bother discussing it in that much detail? Two, there were a lot of other hot button issues that were sucking all the oxygen out of the room, like a public option, an abortion, and maybe a couple of others, a Medicare buy-in or what have you. And then three, it wasn't until after the 2010 elections that anyone thought states would refuse to establish exchanges. And there's a really good article, Law Journal article, that tracks the history that demonstrates that. And so there was no need for them to discuss, because of course all states are going to establish exchanges. And so even when the Congressional Budget Office was scoring these bills, it showed that there would be subsidies in all states, even when they were looking at different bills. Bills that clearly withheld subsidies if states didn't cooperate, the CBO still said subsidies in all states. So that has been the source of a lot of confusion, and I think that this case is probably going to be taught in law schools and administrative law courses and legislation courses for some time, because it really does crystallize the idea that it's not legislative history or legislative intent that matters, it's what Congress enacted.
Usually taxpayers don't have standing to sue in front of the Supreme Court, and is the government making the argument that these plaintiffs don't have standing? And if so, can the Supreme Court throw the case out on that ground and not get to the main argument?
We were worried about that for a while. When we first noticed, Jonathan Adler and I were the first to blow the whistle on the IRS's attempt to expand the statute by issuing those subsidies where it's clearly precluded from doing so by the statute. And we thought, actually I thought it's just like what the president is doing with members of Congress. You may not know this, but he's also giving members of Congress illegal health insurance subsidies, just to brighten your day. But how do we stop that? Certainly members of Congress aren't going to tell them to stop. John Boehner had secret meetings with him to make sure those subsidies kept flowing. Because taxpayers can't establish standing to challenge expenditures just in their capacity as a taxpayer, because courts have held that the injury there is just too small and too attenuated to create a justiciable controversy. So we thought when they're spending this money in these federal exchanges, there's no way we're going to be able to stop them, until a professor named Jim Blumstein at Vanderbilt Law School said, wait a second, those subsidies were triggers penalties under the individual mandate. Under the employer mandate. So in a state that doesn't establish an exchange, there should be no subsidies and therefore no penalties against employers. But when the IRS issues those illegal subsidies, they will trigger illegal penalties against employers. And in 3 of the 4 cases that have been brought against this expansion of the statute, they've had employer plaintiffs. 2 of them were states. One is Oklahoma, one is Indiana. They sued in their capacity as an employer. And there's a similar relationship between the subsidies and the individual mandate. Funny story about how I learned about that, but it's kind of long, so I won't bore you all with it. But that's how these plaintiffs were able to establish standing, because spending this money in this way interacts with the rest of the law to trigger penalties against them, and that gave them standing. That gave them a concrete injury.
Last question.
So Paul Ryan said yesterday that if it gets overturned, that he is going to suggest that we keep the subsidies in place. If we keep the subsidies in place, does that mean then that the employers still have a penalty?
There's a lot of, if all he does is reissue or reinstate those subsidies, notice I did not say reauthorize because they were never authorized. But if he does that, then yes, that will trigger penalties. He will be imposing Obamacare's employer mandate and its individual mandate on tens of millions of Americans, and it will then be a bipartisan program. Now, there have been discussions about how to provide some subsidies without providing the same subsidies, so that they would not be the subsidies that trigger those penalties. So spending money without imposing those burdens on taxpayers. A couple problems with that. One is that it'll cost money, and they have to come up with that money somewhere or else increase the deficit. The left-leaning Urban Institute has said to reinstate all of those subsidies would cost $340 billion over 10 years. And part of that would be covered by, if you just reinstated the subsidies, the mandate penalty revenue coming from all those people who would be newly subject to those mandates. But if Paul Ryan doesn't want to do that, if he just wants to issue those subsidies without issue subsidies without triggering those mandates, then he's going to be blowing an even bigger hole in the deficit. So there are things that Congress can do to provide relief for the people in healthcare.gov states. I think the most important thing they can do is repeal the law. Because repeal, for the vast majority of people affected by this ruling, repeal is relief. Because it gets rid of the mandates and the regulations that are making health insurance so expensive that they need those subsidies in the first place. That won't help everybody in these healthcare.gov states. There will still be people with pre-existing conditions who would not be able to afford insurance after repeal. And that's a very small problem, and if Congress wanted to provide targeted subsidies toward that small group instead of blanket subsidies to tens of millions of people, I think that would be a much smarter approach.
Thank you very much.
Thank you.
Give me 60 seconds more and I will let you adjourn. I want to once again thank the sponsors of this event, the Federalist Society's Portland Lawyers Chapter, the Benjamin Rush Institute, O'Donnell, Clark and Crew, Dr. Kathy and Jack Brown, James Huffman, the Shiloh Inns, and KBNP Radio. Let's give them a round of applause. Cascade Policy Institute and the Washington Policy Center are not supported by taxes. Their existence and continued success depends on voluntary contributions, and I'm tempted to say by people like you, but that sounds like somebody else's fundraising slogan. Michael Cannon is a good indication of what we need to be effective in Congress or legislatures. There are a lot of wonks who know details but lack principles. And there are people like most of us in this room who have principles but not enough time to learn all the details to influence the elected officials. So the free market think tank movement is about providing a combination of the detailed knowledge plus the principles of freedom and free markets to try to have an impact. And I would encourage those of you who are not familiar with the two organizations to get on the email lists. Both of us have email lists to keep you informed, and we're both ready to take tax-deductible contributions. And I'd like to once again thank Michael Cannon for being here.